Indeed. Hello, everyone. A very welcome, warm to everyone present here. I am Dr. Amir Rai, the Vice Dean of International Affairs at Dental School of Tomsk. Well, as you may know, WHO declared the day on the first day of December as the World AIDS Day in 1988, exactly 4 years after the virus was first found. Ever since then, the Health Day has been celebrated in two main reasons. The first one is to support the people who are diagnosed with this virus, with this deadly virus, and to stand for them because of the notion that is common in the society toward these people. Maybe it is somehow negative. And the second main objective of this Health Day is to increase the awareness regarding this disease and protect the human race toward this deadly disease. Today, the Dental School of Tomsk held a campaign about the World AIDS Day on 26th of November, and it had two parts. The first one was an art gallery. The people came, and the benefits would be directed to a charity regarding the AIDS patients called Yaron Musbat. And the second part is about the speech program. We have three valuable speakers today, which will update our knowledge about this virus and about this disease. Our first valuable speaker is Dr. Farda Durudi, who is in charge of United Nations AIDS program and the country director in Iran. Hello, Dr. Durudi. Very welcome to this meeting. We are all ears to get the knowledge about the updates on this subject.
Hello, good afternoon, good evening, good morning to all of you, all audiences from across the world. And I should say that I'm very privileged to be with you in this forum. Before starting, I just wanted to emphasize on a point that this virus is no longer a deadly one. Actually, as you will see on next slides, because of our advancement in finding effective treatment for the virus, nowadays, people living with HIV can have a normal life. So please bear with me for the next almost 20 minutes, providing you with some updates on HIV and AIDS, and I'll be here to take any questions you might have. Since the beginning of the epidemic, more than 85 million people have become infected with HIV, and almost half of them have passed away. Consider a population almost equal to Iran's population have got HIV, and this population has lost half of its size to AIDS. So this is one of the biggest epidemics that human has ever seen. But currently, based on the very recent data that we have and estimates that we are making annually across the world, about 39 million people are estimated to be living with HIV. And in 2022, almost 1.3 million people got infection. At the same time, we lost 630,000 lives to HIV. About 3,600 new infections occur every day across the world. 50% of them are in sub-Saharan Africa. About 360 are among children under 15 years of age, and about 46% of them occur amongst women. What is the situation in Asia Pacific? I will compare statistics of two regions, Asia Pacific and Middle East and North Africa, because Iran sits in between these two regions. And then I continue with the global perspective of the disease. As you can see, we have witnessed about 14% reduction or decrease in new HIV infection since 2010 in Asia Pacific region. At the same time, we have witnessed about 51% decrease in number of AIDS-related deaths since 2010. In Middle East, however, the situation is different. As you can see, since 2000, we are witnessing a crescendo or increasing trend of HIV in this region. Since 2010, we see 61% increase in new infection. Thanks to ARVs, however, in this region, we see a 16% decrease in AIDS-related death since 2010. These two slides are very clear. It clearly shows that number of new cases in Middle East and North Africa is significantly increasing. To address this, United Nations has come up with a program whose vision is zero new infection, zero AIDS-related death, and zero discrimination by 2030. And we have very defined values in terms of epidemiology and public health for this vision. What does it mean if we want to get to zero new infection by 2030? What does it mean if we want to get to zero AIDS-related deaths? I will come to it. Through this strategy, through this vision, we have come up with a new strategy, which is called Global AIDS Strategy, and it covers the period of 2021 to 2026. It uses a lens based on inequalities in various terms, from investment to diagnosis to treatment to societal barriers. We look into different aspects of a global HIV response. The goal, as I said, is to end AIDS as a public health threat by 2030. And it has this specific meaning. So the vision is 3-0, and we have come up with strategies here which are to help us to materialize this vision. These are building blocks of a successful HIV response. It starts by providing accessible HIV prevention treatment services, and it continues to removing societal and structural inequalities to HIV-related services, resources, and tools. And it will end by a fully funded, resilient, integrated, and accessible public and community health system, which adapt innovative approaches based on the guidelines and latest scientific developments. This slide, in short, shows our global status now. As you can see, the upper diagram shows the trend of new HIV infection at global level since 1990. It also compares our progress with our 2025 target. Small blue dot that you see at the bottom of the slide here. As you can see, we have seen a decreasing trend of new HIV infections across the globe. However, in 2022, we still have 1.3 million new cases. It shows that although new infections are declining globally, but not fast enough to reach 2025 and 2030 targets here. So we have a gap here. The same is true on AIDS-related death. AIDS-related death is declining again, and it is within reach of the target by 2025 and 2030. And this is because of accessibility and availability of antiretroviral drugs. Look at this slide. This slide has a lot to share with us. As you can see, the right side of the bar shows regions where the number of new cases of new HIV infections didn't decline. However, here, as you can see, these are regions that are witnessing a decrease in the number of new cases. And this orange one is the global representation of new cases. Again, as was shown in previous slide, we are seeing a decreasing trend of new cases, and we are seeing that almost 38% reduction in the number of new cases. Two regions with the biggest decrease in the number of new cases are East and Southern Africa and Western and Central Africa, meaning that decline in new HIV infection are strongest in regions with highest HIV burden. But look at this part of the diagram, the lower part of the diagram. Three regions, Latin America, Eastern Europe, and Central Asia, and Middle East and North Africa are facing rising up of new cases, with Middle East and North Africa being at the highest level. Let's review our progress towards 2025 targets. Look at here. Since 1990, we have prevented almost 21 million deaths to AIDS. The orange line shows the situation if we didn't have access to antiretroviral drugs. And the blue line represents our current situation. You can see this gap. These gaps are lives that have been saved thanks to antiretroviral drugs. And here you can see how many children were prevented from getting infection from their mothers. 3.4 million new HIV infections were averted among children. The green one shows our situation now, and the orange line on the above shows the scenario if we didn't have antiretroviral therapy. In my last slide, I will explain more on importance of this progress and advancement. And here you can see how we have controlled number of deaths due to tuberculosis among people who live with HIV. As you can see, we see a very significant reduction, 67% reduction from 2010 in number of TB-related deaths amongst people living with HIV. Although we have a gap until getting our 2025 target. So in a nutshell, we have witnessed 59% decrease in comparison to 1995 in number of new HIV cases. In 1995, we had 3.2 million new HIV infection per year. And in 2022, we witnessed 1.3 million. It is a good progress, but it is not enough. For children, we witness a 58% decrease in number of new cases in comparison to 2010, from 310,000 to 130,000 new cases. Beauty of the story is this part. People living with HIV now have access to effective, efficient antiretroviral therapy. At the end of December 2022, almost 30 million people were accessing antiretroviral therapy. However, while we in 2010 only 7.7 million people had access, is a great jump. Almost 77% of adults, people who are more than 15 years, have access to treatment. For children, it is less. Unfortunately, it stands at 57%. About 82% of women, adult women, have access to treatment, and 82% of pregnant women living with HIV and have access to medicine to prevent transmission of HIV to their child in 2022 had access. The sad side of this story is that 9.2 million people living with HIV did not have access to antiretroviral treatment. This slide shows how we have progressed since 2015. The blue bars represent 2015 and the orange bars represent 2020. On the left side, you see percentage of people living with HIV who know their status. Please note that many people who are living with HIV are not aware of their own status. But in 2015, 71% of those who were living with HIV knew their status. In 2022, 86%. When somebody is aware of his or her status, he or she will seek treatment and other interventions which are a necessary for his or her well-being and also his or her family and spouses. The other pack of bars shows percentage of people who know their status and are on treatment. Just compare 67% in 2015 and 89% in 2022. And again, the last bar, which is the most important one, shows how this treatment was effective. If you're living with HIV and if you're on treatment, this treatment is only effective if your viral load is suppressed. As you can see, in 2022, 93% of those people living with HIV who received treatment were on effective treatment, meaning that their viral load was suppressed. When a treatment is effective, when viral load is suppressed, you will gain two results. One, the likelihood of transmitting the virus to others would be minimum, almost zero, especially if, I will explain later, especially if number of copies of virus in a cc of your blood is less than 100. The other gain is that you will live longer. It is not deadly anymore. As you can see, because of effective treatment, AIDS-related deaths have been reduced by 69% since its peak in 2004. In 2022, 630,000 people died from AIDS-related illness worldwide. Just compare it with 2 million people in 2004 and 1.3 million people in 2010. As you can see, during the past 10 years, because of advancement in technology and drugs, we are able to save more lives. AIDS-related mortality also has declined by 55% among women and girls and by 47% among men and boys since 2010. Also in my previous slides, you may have noticed that men are a little bit behind targets in comparison to women across the world in terms of treatment. As you can see in this slide, which shows death among people living with HIV by cause from 2010 to 2022, number of deaths is decreasing slightly over the years. And the blue one, the blue part of the bar represents AIDS-related death, and the orange part of the bar represents other cause. As you can see, the share of other causes of death among people living with HIV is increasing, while total number of death is decreasing. It means that, in another word, that as people living with HIV are living longer, we are facing a problem which is called aging of HIV. People are dying at elder ages and due to other causes, for instance, cardiovascular diseases, cancer, accidents, these kinds of things, not AIDS-related causes. To achieve that, the world has invested. And this is the diagram of world's investment. And you can see that since 2010 to 2022, in general, investment on an effective response to HIV has increased. The red part of the bar represents domestic investment, both public and private. The light blue represents contribution of the United States bilateral program. The deep blue one represents global fund contribution. The green part represents other international contribution. And as you can see, the main part of investment across the years, across the world, is domestic. If you want to have an effective response to HIV, you have invested on your domestic resources. But I would like to draw your attention to the yellow bar on the right. In 2025, we need more than $29 million to address HIV. What we have spent in 2022 is almost $21 million. So we have a gap of about 10 million, more than $10 million to get to 2025. I have a few words with you as dentists, oral medicine specialists, and students in such a field. The main modes of HIV transmission are very clear. Blood and blood products, sharing drug injecting equipment, including syringes and needles, unsafe sex, which stands for the main mode of transmission in the world, and vertical transmission from mother to babies in their wombs. There is no other way for transmission of HIV. What should we do as health practitioners, as surgeons? There is a standard measure, which is called the universal precaution measure. It is simple, but is very effective for us as doctors and dentists and surgeons. You should consider anybody, any patient coming to you to have HIV or hepatitis or other diseases. You should protect yourself and other patients by wearing gloves, shields, glasses, whatever which is necessary to prevent transmission. Also, you should observe all precautionary measures in protecting your equipment from being a vehicle to transmit a virus. In very unlikely event of occupational exposure, because it might occur, you may penetrate your fingerprint with a needle. There is a standard antiretroviral regimen, which is called post-exposure prophylaxis. Within 72 hours after this accident, if the one gets the required ARV, the likelihood of getting HIV would be very near to zero. Where to find this regimen, and if we are exposed to the virus, the address is here. Go to this website. I would appreciate that it is not very much user-friendly, but you will find it. If you go to this website, then you go to مرکز بیماری‌های واگیر، اداره بیماری‌های واگیر, and from there select HIV and AIDS and click on that, and you will find addresses of all behavioral disease centers in which you can have access to post-exposure prophylaxis in case of accident. And they have been organized, arranged based on medical universities under which area you're working. I hope you found this useful. Thank you very much for your attention.
Thank you, Dr. Durudi, for your nice presentation. It was a great update on the AIDS Day, and it was really interesting that we have decreased the AIDS-related deaths. But on the other hand, we have new HIV infection increased in the Middle East. So it needs a more dedicated program to control this disease. Although we are in 2023, but we need to work hard to control this disease. And based on what you said about the global AIDS strategy, we hope to end this pandemic around 2030. I want to express my gratitude to this great presentation and update. It was really nice, and I myself really enjoyed the whole topic. And I just wanted to make a question that is, do we have equal access to an effective therapy through the whole world? And the answer, I think, is no. but how can we make this discrimination lesser and make, for example, the Middle East to come closer to the statistics of the United Nations? Dr. Durudi,
Should
you're
I,
on
should I,
mute.
yeah, sorry
Yeah,
for
I
that.
hear you.
Yeah,
I hear
should I
you.
collect all questions and answer afterwards, or I can answer directly to each
Yeah, please go ahead
question?
for this one, and I will direct the other questions.
Okay. On the point is not lack of access to effective treatment. All countries have access to effective treatment. And interestingly, in countries like Iran, it is free of charge. The reason that Middle East, North Africa, or Central Asia are facing an increasing number of HIV sits at prevention side of the disease mainly. And for prevention, we have 5 main pillars, five main programs that should be implemented in each country for those who are at risk of HIV. Unfortunately, those prevention measures have not been fully implemented. This is one side of the story. The other side is stigma discrimination. Stigma discrimination prevents people to do testing and learn about their status. And discrimination, stigma discrimination also prevents them from following up on their effective treatment because they're afraid of being labeled as bad people with bad practices. These are two main problems in regions such as Central Asia, Eastern Europe. However, in Middle East and North Africa, we have a very special situation. Middle East and North Africa is characterized by disparities in all fronts. The poorest countries in the world are in this region: Somalia, Yemen, you name it, Sudan. The richest countries in the world also sits here: Kuwait, Emirates, Saudi Arabia. This disparity encourages a lot of mass movement of people between countries. And when people are on the move, they are at risk of getting variety of diseases. On top of it is STI, sexually transmitted diseases, including HIV. In addition, this region is facing one of the most, not one actually, more than one, devastating man-made disasters. It is a home of wars. And during war,
right.
Countries do not invest on health. They invest on other priorities. So, and this region again is facing a lot of stigma discrimination, not only on HIV, but also on other diseases. Therefore, if countries in this region want to really tackle HIV, they have to invest on their prevention programs. They have to expand their treatment coverage, and they have also to tackle stigma discrimination.
Really, thank you again, Dr. Farda Durudi. It was a nice meeting with you, and we all enjoyed this meeting. If any of the participants have any question, we are all ears to listen. And if there is any comment we can address, we can go for them. And let us check the comments and questions.
I cannot see chat box. If somebody helps me with chat box. If there is any question on chat box, I would be more than happy to answer.
Okay, I think the comments and questions are answered fully. And thank you again, Dr.
Thank you.
Durudi. It was
Thank you
really
for having
nice to
me.
meet you. Hope to see you in person in the future events.
Thank you very much. Have a good day. Bye-bye.
Bye-bye. Hello again, everybody. Thank you for being with us. Our second speaker is Dr. Arghavan Tonekaboni. She has a degree of DDS and MSc, and she is the Associate Professor at Oral Medicine Department at School of Dentistry, Tehran University of Medical Sciences. She will share with us the knowledge about the oral manifestations of the AIDS and also the dental considerations that we should know toward these patients. And we should be all aware about these two main topics. Please start, Dr. Arghavan Tonekaboni. We are very glad to have you in this meeting. We are all ears to listen to the updates on the oral manifestations and also the dental considerations. Thank you.
Hello, thank you, Professor Rai. Ladies and gentlemen, good evening. I'm glad to be in this opportunity, and I hope I can have a very small role in AIDS Day. First of all, I want to talk about this picture. It is a design for Times Journal in year of 1989. This poster can share some information with us. Medicine is full of critical subjects. One of them is AIDS or HIV. We should know there are some obstacles in critical subjects like HIV and AIDS. For example, in this picture, we can understand that ignorance can be equal to fear. And after that, silence can provide death without any good information for us. So we need to fight AIDS and act up for AIDS to have a better situation for our patients and for our society. It means that there are lots of critical subjects in medicine that they create a storm at their first onset, but instead of close follow-ups by healthcare providers, they pay less attention to these subjects. After some years, maybe they provide ignorance for the healthcare providers and patients, and after that, it can fade up and leads our patients to very bad death. So we need a good information about each subject and close follow-ups in these subjects. Let's have a good review about them, and in purpose, I try to repeat some of these subjects. This single-stranded RNA retrovirus has two species, HIV type 1 and 2, and other subgroups in these types, and this can lead us to have infected patients. About 37 million people live all around the world with HIV, and they have a different distribution in many countries all around the world. Only 81% know that they are involved with this infection, and the rest doesn't know. So they provide complex situation for themselves and ours as healthcare providers. 2 out of 3 people living with HIV are on antiviral therapy, and only 59% of people living with HIV have undetectable level of virus. HIV or human immune deficiency virus is a virus that attacks the immune system, specifically targeting CD4 cells, which are crucial for the body's defense. So the most important things is to know the transmission base, and for dentists, some of them are very critical. We know the most popular transmission, for example, homosexual, heterosexual, IV drug users, or unsanitary injection and blood transfusion. Vertical transmission by mother to their child, isolate, and the other things that I want to mention is this virus is isolated from some fluids from the body, for example, saliva, tears, milk, CSF, urine, amniotic fluid. But transmission is only reported by blood, semen, milk, and vaginal secretion. So it can be different that we can isolate this virus from some part of the body that maybe it's not transmitted by them or haven't been reported up to now. The other things that I want to talk about that is there are some myths about transmission. You can see in this picture that the second row of the picture can show us that most of our people, most of our patients maybe suffer from misinformation, and maybe it's one of our duty that we should talk with them and make them call to know that they should know only the correct information and didn't misdiagnose this source of information with each other too. Another things that we can talk in this meeting is maybe by some situation we need indication of diagnosis test. For example, when someone go for STD screening test, sexual transmitted diseases, maybe one of the tests that we should prescribe is and ordered is HIV. After all, for pregnant women, one of the most obligatory tests would be HIV. If a patient is diagnosed by tuberculosis, one of the things that we should understand would be the involvement of HIV or even AIDS. Another thing is for patients who suffer by flu-like symptoms, that these symptoms didn't respond to routine care. Maybe one of the things that is needed is HIV test. Some group of people are very suspected for some routine tests. For us as dentists or healthcare providers, if we should know that most of our patients maybe didn't aware of their situation about HIV or any infected diseases. So it is very important that checking each one who works as healthcare providers for a routine follow-up, because maybe this test is needed for their situation. As a risk assessment, we should know that HIV is has the lowest risk in our situation, in our medical risk, situation or dental clinics. But because we don't have any good, for example, vaccine or anything that can care us about this infection, it is very important to know the situation of your patients. And we know that percutaneous or mucous membrane or non-intact skin has different type of risk for transmission. So it is very important to know the type of tissue that you have contact with that, and even the type of your patients. One of the things that can affect the situation of transmission is our immune response and immune situation. So it is very important to know that immune response of the body is very important, and maybe we can talk about the quality of our immune system, about the getting infected with this virus or any other viral situation and infection that we suffer from that. So it is very important to know that most of the viruses have a latency, and it would be depend on the situation of the body of each person to know this latency about the situation of the virus in the body. So we have different type of tests: antibody test, antigen antibody test, or nucleotide test. So if for choosing this type of the test, it is very dependent on the days that we need for getting answer. For example, for antibody test, from 23rd day of the infection to 19th day, we can get answer, and we can understand the most immediate answer can be checked by nucleotide test. So we can understand after 10 days that if we get infected with this, for example, for post-exposure or not. So maybe when we want to take care or to understand the situation of the exposure and post-exposure of the healthcare providers, it is very important to understand the source of the the patient who is the source of the infection and virus, and the situation of the immunity of the healthcare provider to understand the situation of the test. We can understand that HIV untreated infection has 3 phases. The first phase, or primary infection, can happen in 3 to 12 weeks, and most voluntary test for HIV is based on CDC rules, can be done from 13 years of old age, and after that until 64, most people can have voluntary test, because in this time they can be susceptible to this infection by the situation of their lifestyle and body. The viral syndrome in primary infection can involve and include these manifestations. For example, rash, headache, lymphadenopathy, pharyngitis, myalgia, arthralgia, GI distress, and oral ulcer or night sweat. All of these, you can understand that most of them can happen when you have any type of viral infection. So we talk about this situation when it happens more than 2 or 3 symptoms with each other, and they are not affected by any supportive care. The second phase is prolonged latency, and we can understand by this name that it can be prolonged, for example, about 10 to 12 years. So most of our patients may be in this time, and this long latency can affect the situation of knowing and involvement of the patient. The third phase is apparent disease, and most of the time, maybe in this phase, the patient is totally known patient, and they are aware of the situation of their body. I want to talk about post-exposure of the, as Dr. Doroudi talked about the post-exposure protocols. I can shorten this slide, because the most important thing is to know the source of the virus, the patient who makes the exposure for a healthcare provider. And it is very important that we should know that we need the follow-up test. For example, after we talk about the nucleotide test, that it can provide the response after 10 days, but we need a follow-up test, because after sometimes we should check, and we must check it because maybe our immune system changed the protocol of the infection. So it's very important to have the final test at least for 12 weeks after post-exposure. After finding ART or HART, antiretroviral therapy, we should aware that most of our patients have very low oral manifestation and even clinical manifestation. But we suffer from some sign and symptoms that involved by their medication. For example, maybe they are these types of medications have nephrotoxicity, hepatotoxicity, and for dentists who want to cure the situation of the oral cavity, maybe knowing about the situation of nephrotoxicity and hepatotoxicity is very important, because even Stevens-Johnson syndrome have been reported for people who are on antiretroviral therapy. So we should aware of the side effect of their medications, that, and maybe our patients who suffer from HIV infection come to dentists for their oral manifestation who happened by their medications too. Here you can see some types of toxic epidermal necrolysis or Stevens-Johnson syndrome. These are very critical situations for the patient, but I hope that most of the patients didn't pass this type of situation, but we should aware of this too. We should categorize the oral manifestation of HIV infection about the type of response. For example, when our patients suffer from the problems and complexity about the immune system, they suffer from fungal, viral, or bacterial infection. And the most opportunistic fungal infection in oral cavity would be candidiasis, pseudomembranous erythematose, and angular cheilitis are the most popular and common fungal infection that happen in the oral cavity. Besides, as viral situation, herpes simplex, herpes zoster, cytomegaloviruses, and heteroleucoplakia are the most important part. And for papillomavirus involved, the manifestation can happen too. We should aware about some neoplasm, for example, multifocal neoplasm like Kaposi sarcoma, which can happen with HHV type 8, or even lymphoma that happens in people who suffer from HIV infection. Bacterial infection can happen specifically in periodontium, for example, necrotizing ulcerative periodontitis, tuberculosis in oral cavity, or for example, linear gingival erythema in oral cavity too. So we have different type of oral manifestations. Some of them are most common in adult, and some of them are most common in pediatric. But for example, fungal infection is very common in both of these groups, even adult or pediatrics. And besides that, for example, oral hairy leukoplakia or Kaposi sarcoma is very subjected to adult patients who suffer from HIV. And lymphoma is the second group of neoplasm that happened in these patients. For in pediatric, we have oral ulcers, for example, recurrent stomatitis, minor after or major after, and herpetiform type. So it is very important to be aware of the situation of our patients. Here you can see the type of oral candidiasis that can happen in HIV infected patients. I want to take your attention about that. Most of the time, we know as a dentist that oral candidiasis can happen in patients who are very old or very ill, and it is opportunistic infection. So we should search about any risk factor that can involve with a patient with oral candidiasis. For example, using any denture or any appliances in their oral cavity. And if we prescribe medication and by antifungal therapy, they didn't answer to the medication, maybe after that we can talk and we can search about HIV or something that happened for their immune system. Maybe even in a diabetic patients, they suffer from persistent oral candidiasis. So we should aware of not having a stigma for our patients, because maybe there are lots of other reasons that susceptible the patients to oral candidiasis and fungal infection. The most important type of fungal infection as candidiasis is thrush or pseudomembranous candidiasis that has, as you can see in the last slide, about the curd-like situation of the oral cavity, and it can be wiped off by the clinician, and it is a very good point of diagnosis for us in oral lesions. The other type is erythematous or atrophic candidiasis, and it is very considerable by patchy depopulation of the tongue. The other type is hyperplastic candidiasis or angular cheilitis. So it is very important, for example, with patients with decreased vertical dimension of the face, we have very important factor for susceptibility to angular cheilitis too. You can see some pseudomembranous candidiasis. Besides that, in the other slides, we can see atrophic or erythematous candidiasis. And all the time, I want to have your attention about that. These patients are maybe sometimes we can understand a new case of HIV by visiting a patient who suffered from candidiasis and didn't answer to our antifungal therapy. Here we have some hyperplastic candidiasis, and after that, this type of angular cheilitis. And we should know that for our patients, the first line of medication for candidiasis is poly-N medications, and after that we can search for azole medications. But in HIV and specifically in AIDS, most of our patients are so resistant to our normal medications, so it is very important to be aware of our response, our patients' response to our medications too. Sometimes we have very invasive fungal infection. For example, for histoplasmosis or mucormycosis are some fungal infections that can involve HIV patients and specifically AIDS. So it is very important to be aware of the situation. For example, in mucormycosis or even in histoplasmosis, when you diagnose the patient with this situation, it is very important to be aware of the immune system of the patients, and one of the most things is checking them by HIV test for understanding the situation of the patients. Oral viral infection, for example, HSV, VZV, CMV, EBV, and HPV or HHV type 8 are the most susceptible viral infection for HIV infected patients. So it is very important because sometimes we should know about that. For example, in Iran, most of our patients are susceptible and have any contact with HSV before. So it is very important that we should aware of the situation of the patient. For example, if they report many continuous infection or recurrent infection of herpes viruses, maybe it's very important to check the situation, and maybe after that our patients be aware of the situation of HIV infection too. Most of the time the treatment for them is very different and very complex and problematic. They can't answer to acyclovir or valacyclovir, and maybe we need, for example, prescription in hospital situation and very complex situation for treating and curing the situation. You can see some type of herpetic stomatitis in HIV infected patients that can provide very complex situation for them because they suffer from very bad pain and oral stomatitis. So it's very hard for them to be aware of the situation. As a varicella zoster and VZV infection, herpes zoster can provide a post-herpetic neuralgia for them, and it is very painful for them because the pain is very very hard for them, and it can affect the whole body of the HIV infected patient because they suffer from a very bad situation of immune system, and by having oral pain they can't have a good lifestyle, they can't provide food for them, and it is very important to have a normal function by the oral cavity. You can see some types of varicella zoster virus in HIV infected patients, and it can make the situation so complex for them. CMV is one of the viral infection that in healthy patients it can happen very easy. They maybe some specific oral ulcer can happen, and after a while they are self-limited. But in HIV infected patients, even there are some reports about the painful granulomatous ulcers with punch out irregular margins, as you can see in your right picture in the slide. So it is very important to be aware of them. And I should mention that sometimes we need culturing of the oral lesion to understand the, for example, the infected reason of this situation too. As oral Epstein-Barr infection, for example, oral hairy leukoplakia, we should know that in these patients, using acyclovir or pedophyllum resin maybe is effective, but we should aware that oral hairy leukoplakia is a oral lesion that can show us we have a very decreased quality of the immune system. So even if our patient has the history of transplantation, for example, organ transplantation, and he or she is a known case of immune suppressed situation, for example, because of their organ transplantation, maybe they can suffer from OHL too. So it is very important that we should know that OHL show us, and it can be a marker of the decrease in CD4 cells under 300 per millimeters. You can see different type of oral hairy leukoplakia. Most of the time, we can see oral hairy leukoplakia in one side or both side of the lateral border of the tongue, but we can see it in other parts of the oral cavity, for example, in other parts of the periodontium, even in buccal mucosa, or for example, in the floor of the oral cavity. And the thickness of the keratosis is totally different case by case, and maybe even the size of the lesion can be different, and there's no involvement and relation to the type of the immune response or immune situation of the patient. Only it can happen when you have decrease in CD4 cells, so it can be a marker for lower quantity of the CD4 cells. The other things about oral papillomavirus, we should aware that HPV infected lesions can happen in oral cavity in different types of manifestation. For example, we have Heck disease or squamous papilloma, or the most important about these lesions is they are mostly in the situation of exophytic lesions, papillary lesion with a cauliflower-like surface, and sometimes maybe we can have some smooth and flat lesions which relate to HPV in oral cavity too. But the most important is the treatment for them, because we have different type of modality for treatment. But about the HIV infected patients, it's very important to the situation of the patients to choose the treatment modality for them. You can see some type of HPV related lesion in oral cavity. It can be multiple, multifocal, or even in the type of very limited situation of the lesion in the oral cavity. Here we have a case for Kaposi sarcoma. It is a multifocal Kaposi sarcoma, so it can be happened in the hard palate, or if it happens in the body, most part of the body are lower extremities, but in the face we can see patients in their nose, or other parts of the face can involve with this lesion too. We have some periodontal infection situation in HIV related patients, for example, linear gingival erythema, or in some complex situation, maybe our patients suffer from necrotizing periodontal diseases, for example, necrotizing ulcerative gingivitis or necrotizing ulcerative periodontitis. And the rapid destruction of the tissue can provide very bad and complex situation the oral cavity, because they suffer from halitosis and the mobility of the teeth. So it is very painful, very bad situation for these patients, and it can affect the whole body situation of these patients too. We know that aphthous ulcers can happen in any patients that suffer from a problem with their immune system. So if our patients suffer from HIV infection, the most important thing is that the size of their ulcer can be very large, and even the recurrence of the aphthous ulcer in their oral cavity can be more than the most popular situation that we expected in our patients. So it is very important to know the range of the size of the aphthous ulcers in the patients, and the time of recurrency and frequency of the aphthous ulcers in oral cavity of our patients. Here we have some types of necrotizing stomatitis in the oral cavity that it happens in some patients with HIV infected situations, and maybe in this time we can decide about the situation that patients start in the onset of AIDS in their body, because it can show that it is the lower time of the immune system, and we can understand it is the onset of AIDS in this patient. So we talk about some neoplasm in HIV infected patients, for example, Kaposi sarcoma or oral hairy leukoplakia, and for example, lymphoma that can happen in our patients who suffer from HIV, and it is very bad situation because by the situation of the immune system, checking and curing this situation can be very, very hard. We should know and aware of some oral pigmentation, and this pigmentation can be happen in two different types. For example, some of the patients suffer from oral pigmentation because of the endocrine system involvement by HIV and HIV infection, and the other type is because of only being medicated by antiretroviral virus therapy and medication, and can be they could be only medication side effect as oral pigmentation. Here we can see some types of non-Hodgkin lymphoma in HIV infected patients. And the other types of problematic situation in salivary gland involvement, sometimes only for HIV infected patients, maybe there are some swelling in the major salivary gland, and we can understand the swelling of them, or sometimes maybe they have some Sjogren-like diseases, and maybe they suffer from, for example, xerostomia or hyposalivation, and it can provide some complex situation for the caries and teeth situation. We have some situations specifically in pediatric HIV infected. For example, persistent generalized lymphadenopathy can happen in pediatric patients only because of HIV infection. So checking the lymph node of our patients in dentist office can be a valuable situation, part of our examination. So we can understand that our oral manifestation can be predictive or indicator or early lesion of the situation of the HIV infected patient. The most important lesion is oral fungal infection, for example, candidiasis. But another time I want to pay attention, I want you pay attention about the, I talk about the oral candidiasis, oral fungal infection that even can't respond to our antifungal therapy, normal antifungal therapy. So it is very important to follow your patient's response to our medication. So as a dentist, we have another duty. For example, maybe HIV infected patients come to our office and they want some dental procedures. We should be aware of the situation of the patients. For example, we should have a complete blood test, CBC, for them, and check the situation of their body. For example, the immunity quality of the system by checking the white BC and checking the all the type of blood cells. For example, maybe they suffer from thrombocytopenia, maybe they suffer from anemia or pancytopenia. So it's very important, because if you have some problem about this situation, maybe your patients need antibiotic prophylaxis before starting your dental procedures. And sometimes they suffer from some oral manifestation, which are not very extensive. But for example, the situation of the HIV infection makes them xerostomia or some oral lesions that by some good follow-up and examination, you can cure them and you can help their their quality of life. One of the things that it is that can be important for healthcare providers is exposure by your infected patients. It's very important that when we have some exposures, it is very important to know that the type of exposure is very important. For example, you should check the instrument. Is there any blood on the instrument or not? And the type of needle that makes the exposure for you, it is very important. For example, if you use a syringe, or if you use, for example, an endodontics file, it's very different for the type of exposure and transmission that happen to the healthcare provider's body. So it's very important to know the type of the exposure, type of the transmission, and the depth of the exposure that can happen, the situation of that. So we can understand that most of the patients that come to dentist office, maybe they are not aware of the situation of their body. So we should check the situation, and we should know the situation of the HIV infected patients. Even taking a very normal CBC of them can help us to understand the situation and do a very good procedure, dental procedure for them without any sequel or complication. So it's very important to be aware of the situation of your patients for doing some medications or prescribing medications or doing some dental procedures. We should aware of that some patients may be in their latent form, and this type of patients can be very effective source for us. So it's very important to be aware of the self-protection by many rules and guidelines that we have, and we should aware of the situation for them, because the most thing about the healthcare providers is to be aware of the situation because they are responsible about their patients and themselves both at the same time. So we should know that we have two types of patients. Some of them are HIV infected, but some of them maybe suffer in the time of AIDS. In time of AIDS, most of the people maybe have, sometimes they are HIV antibody asymptomatic. So it's very important to know to be aware of the quantity of the CD4 cell, and to be aware of the clinical manifestation of the situation of these patients when they are in the time of AIDS. It's very important to be aware of that, and all the time we need a CBC about them. We should know that this type of decreased immune system in HIV infected patients, maybe they provide some vaccination for them, but they can't receive, for example, some vaccines like mumps, that they are weakened viruses, because this decreased quality immune system can suffer from even these type of vaccines too. So it's very important because we should aware that only some vaccines that they don't provide viruses in the body can be safe for this group of the patients. Thank you very much for your attention, and thank you, Professor Rai, for inviting me to this session. Thank you so much.
Very thanks, Dr. Tonakaboni, for this nice presentation. We are now updated on the oral manifestations of the AIDS, and regarding the dental considerations, it was a nice update. Thank you. As you mentioned, the oral manifestations, in summary, are a result from the immune system that is suppressed, and we should be aware about it. And as you mentioned, if we start the treatment earlier, we can control the disease more easily. And one question that may raise in the mind is that we have a prolonged phase of the disease, which may be up to 10 years. So do we have to get tested about the HIV, even if we are not at high risk? I found that CDC recommends that everybody between the ages of 13 to 64 needs to get tested at least once at their life. And even if they are at more risks, they can increase the frequency of getting to be tested. Again, thank you. And I want to ask the participants if they have any questions. Please raise your hand and ask your question. Dr. Moradipur, please open your mic and you can speak now if there is any question.
Hello, everyone. Can you hear me?
Yes, we can hear you, please.
Thank you. Actually, I don't have any question, but I just wanted to thank you, Dr. Tonekabani, for your kind words and express my sincerest gratitude for your exceptional speech, which was both enlightening and enjoyable. Thank you, and I know that your insights were invaluable, and I am confident that with your continued assistance and dedication, we can make significant strides in combating and ultimately eradicating this pandemic. Thank you again, Dr. Tonekabani, and also Dr. Dorudi, because unfortunately I didn't get the chance to thank you after your speech. And the last but not the least, I want to thank you all to join this event, because these kinds of sessions, I think, can be a start for the future and help us to play our roles for solving both health and also social problems such as AIDS.
Thank you so much. Thank you, Dr. Moradipur.
You're welcome.
Thank you, Dr. Moradipur. Thank you, Dr. Tonekabani. Now we want to go for our third valuable speaker, Dr. Ali Naghi. Thank you. Who is a clinical epidemiologist and the associate professor at Research Deputy of Iranian Research Center for HIV/AIDS, Tehran University of Medical Sciences. As we may have known, there is a huge discrimination in treating patients that suffer from AIDS and suffer from HIV indeed. And this kind of discrimination needs a lot of fund and needs a great source of foundation. So we may address the importance of having some charities. According to this question, I want to ask Dr. Ali Naghi to start his presentation on this topic, and we are all ears. Dr. Ali Naghi, hello, how are you?
Hello, everybody. Good afternoon, and my pleasure to invite me for this lecture. Let me start.
Okay, we are all ears.
Yes, thank you. We are going to talk about Positive Club abbreviated pieces in Iran. We have two main centers in Iran. regarding HIV and AIDS issue, they are voluntary counseling and testing, or abbreviated VCT centers, which focus on ART and testing, especially treatment, and other setting is positive clubs, focus on care of the people living with HIV. In fact, one of the most remarkable achievements in Iran is establishment of Positive Club in 2005, and Iran was encouraged for establishing of PCs by UN agencies, and PCs provide services for key population, including people who inject drugs, and HIV positive, vulnerable women, HIV positive, vulnerable women, HIV positive, and transgender HIV positive, and in overall people living with HIV and their families. 38 PCs have been established in Iran and are covered by welfare organization. About 6,000 people are member of the PCs in Iran. The objective of the Positive Club is psychosocial support, is the main mission of the Positive Club, empowerment, positive prevention, included peers group for prevention of HIV and prevention of HIV transmission to general population. And the most important mission is the decreasing stigma and discrimination in Iran, and also increasing adherence. I should mention that antiretroviral therapy is the ultimate of the people living with HIV, and is very important for people living with HIV, and for virus suppression. Full adherence to ART is mandatory and is very important. And also linkage to treatment and care is the other mission of the Positive Club, especially linkage to voluntary counseling and testing center, abbreviated to VCT centers in Iran, one of the most important centers for delivering treatments and care to people living with HIV. We have some challenges regarding the HIV issue in Iran. The first challenge is HIV testing, and in Iran, we couldn't cover the all groups, and achieving to the 1990 goals in HIV testing, but the CDC is increasing the coverage of HIV testing. The other problem is the retention on care and treatment is difficult for people living with HIV, but a linkage, by linkage to the VCT centers, we can retain the patients on care and treatment. The most important mission of the Positive Club is adherence to ART. Is very important because the treatment is the ultimate for people living with HIV. And the recommendation is the strict adherence to use of antiretroviral drug is highly recommended, because for suppression of the virus, and also prevention of transmission, HIV transmission to the community. Strict adherence is very important. Regarding the issue of stigma and discrimination, you said the Positive Club is a free zone for stigma and discrimination. And one of the mission of the Positive Club is the reduction of the stigma and discrimination, and the good setting for the modeling of social modeling for reduction of stigma and discrimination. Of course, the discrimination, zero discrimination is very difficult, but it is possible. Stigma is impossible because the stigma is the inside the people mind, but discrimination is the action of the stigma, and by positive club we can reduce the discrimination among the people living with HIV and also in the community. Based off the UNAIDS 1990 targets and getting to zero strategy and fifth strategic plan of Iran, and also positive has dignity and prevention, abbreviated to PHDP. We design 9 activities for positive clubs in Iran. First of all, making friendly environment, using staff with positive view regarding the HIV, and welcome to the members reception along with tea and coffee, to keep confidentiality and privacy of the members, and getting comments from the members, and do the actions in the positive clubs are the related to the making friendly environments. As I should know that we use peers in the positive club environment and for managing of the positive clubs in Iran, because the people living with HIV are intended to receive the services from the peers, and because for the sympathy and empathy along with accompanied by the peers is very important for the people living with HIV. And other activity is educational activities with the focus of treatment and care, and talking about antiretroviral therapy, especially full adherence to ART and the necessity of adherence to ART for suppression of virus. The other topic for education is stigma and discrimination, and the role of the people living with HIV in decreasing of stigma and discrimination in the positive club is very important. The other issue is life skills and life skill modification, correctness of life skills is very important for the people living with HIV. Other issue is HIV and nutrition, especially vitamins and minerals are very necessary for most of the people living with HIV, and also prescription of the vitamin D, because of the most of Iranian people are have a lack of vitamin D, and they are vitamin D deficient. HIV transmission rules and prevention is the other activity for education in clubs. Opportunistic infection, as Dr. Tonekabani said, like candidiasis, especially esophagus candidiasis, and so on. And talking about co-infections in positive clubs is very critical, especially hepatitis B and hepatitis C, because based on the previous research, the most co-infections are hepatitis B and C. Of course, in this time, the co-infections are decreasing among the people living with HIV, but the treatment of the co-infections are very substantial for people living with HIV, since the co-infection can accelerate the virus replication in people living with HIV. Pregnancy hygiene and also healthy child hearing is other topics for education in the clubs. And in this time, HIV and aging is very important for people living with HIV. As Dr. Doody said, by increasing the age of the people living with HIV, attention to the comorbidities and other morbidities like diabetes, like coronary artery disease, cancers, and so on regarding people living with HIV are very substantial, and by increasing the age of the people living with HIV, the clinician should attend attention to the comorbidities among people living with HIV. Other critical issue in positive collapse is self-care, especially by mobile. Mobile self-care is very important, and we prepared the guideline for, especially for women with HIV, and also we piloted the mobile self-care for people living with HIV, and it seems that the people living with HIV can use the self-care by phone and for reminder and for as a reminder for clinical visits. Other non-healthy issues are computer, music, calligraphy, cell phone repair, and book carrying are ongoing issue, and training issues in the positive collapse. And for public awareness, setting up the booths every year is very important for educational goals in positive collapse. Other activities in positive collapse are the consultation and voluntary testing and reinforcement and encouragement of the consultation for doing the laboratory tests such as CD4 count and viral load, and doing regularly in the VCT centers, and encourage to, and the positive collapse encourage the patient to do the CD4 count and viral load, and also cooperation between the VCT centers as the setting for with the focus of the testing and the treatment ART, and the positive collapse as a center for care is very important, and VCT centers usually are adjacent to positive collapse and refer the patients to the positive collapse and vice versa. And also other activities, the services for serodiscordant couples, HIV positive and HIV negative, and the prevention rules for preventing of the HIV to HIV negative couple is very important, and suppress of virus in the HIV positive couple are very important, and so that the positive collapse get focus on the adherence to treatment for serodiscordant couples, and also using condom for prevention of the HIV to the negative couples. The other activities, the prevention of mother-to-child transmission, abbreviated PMTCT, as Dr. Doody said, are very important, and it seems that the reduction of the people living with HIV number in the world, or new infections in the world, are due to prevention of mother-to-child transmission, and the world is moving on the prevention of mother-to-child transmission. Social marketing is another activity in the Positive Club with the focus of condom promotion and attending in TV and radio programs by peers in Iran occurred, and right now in some programs, peers can attend in the programs and train the general populations. The other activities, publishing of pamphlets, posters, and banners. And the other activity in Iran is the hotline counseling in some pieces. And the counseling by distance is very important. And the peers on the phone are answering the questions of the general population regarding the behaviors or so on. Yes. Okay. The other title is Health Promotion and Access, including referring the new PLHIV from the adjacent VCD center to the PCs and vice versa. As I said before, medical tests such as CD4 count and the viral load, which are very important for follow-up of the patients, especially viral load is very important, but is not cheap, and people living with HIV should tolerate the cost of the viral load, and the PCs help the PLHIVs for getting the viral load and paying the cost of the especially viral load and CD4. Of course, in the most of the VCD centers, deliver the viral load and CD4 free of charge, but in some places, maybe it's not possible, and the PLHIV maybe should refer to the private sector, and for tolerating of the cost, the Positive Club can help the PLHIV for paying the cost. Dental services costs are another health promotion and access activity of the Positive Club. But as you know, the dental service costs are very high in Iran, and also the insurance cannot tolerate in and not cover the cost of the dental services. Even for general population, in some clubs, not all the clubs can provide some section of the cost for getting dental services. Of course, in the QMS recently in the Yalla building near of Imam Khomeini Hospital, dental clinic are providing services with a low cost to the all the people. Also, people living with HIV can getting the services from the Yalla clinic. Other activities that referring PLHIV to VCT centers for receiving vaccinations. As Dr. Torekhabani pointed out, the vaccination services like pneumococcal and influenza and so on, and referring to the VCT centers is the job of the Positive Clubs. And the other activities, lifestyle modification, as I pointed out previously, and in-person and group counseling in the Positive Club are very important. And based on the Positive Club ability, in-person or group counseling should be done, and are the very effective and very comprehensive activity in the Positive Clubs. Other activity regarding health promotion is athletic, recreational activities and entertainments, such as ping pong, soccer, volleyball, swimming, chess, and so on. Also, aerobic resistance exercises, mindfulness, meditation, yoga, movies, and music inside or outside. Positive clubs, especially resistance exercise, are very good for people living with HIV because exercise, resistant exercise reduce sarcopenia or muscle loss in people living with HIV and increase CD4 count among people living with HIV. Other activities in the club, psychiatrists visit for counseling, psychological support, and medical treatments. And based on the positive club ability, maybe 1 or 2 times a week, psychiatrists can be attended in the visits of the people living with HIV, but the visits are has a very high cost for the positive club and a little difficult for delivering of the services to the member of the clubs. In the Iranian Research Center for HIV and AIDS, we are adjacent of the close to the positive club, the positive club. We try out many non-pharmacological intervention, including positive thinking, social support, especially by family members, mindfulness, acceptance and commitment therapy, obligated act, compassion-focused therapy, schema therapy, lifestyle modification, life skill group therapy is very appropriate and good for people living with HIV. We have a good experience regarding group therapy, narrative therapy, cognitive rehabilitation, social marketing, neurofeedback, NLP or neuro-linguistic programming, combined training, mobile application, and HIV Anonymous. We tried all the intervention, non-pharmacological intervention in the clubs, and the results are very effective. And as a researcher, should say that any interventions on the people living with HIV are effective, and it seems that these groups are very sensitive to interventions, special psychosocial interventions, and psychosocial profile and CD4 count steadily increase and improve by the interventions. I don't know, but I think that this group of patients are very sensitive to the non-pharmacological intervention, maybe due to the high prevalence of depression, anxiety, and other disorders among this group. For example, near 80% of the people living with HIV have depression and anxiety and stress, and we have a very high prevalence of some disorders among these groups due to stigma and discrimination. Because the stigma and discrimination is very high among this group and can influence the psychological profile of the people living with HIV. Okay. Other activities regarding empowerment is the computer training sessions regarding computer, English language, music, calligraphy, and cell phone repair. Handworking like wood carving and handbag, leather handbag, and creative photography, organizing competition between the members, and attending in the competitions like darts, ping pong, chess, and so on. And the other activities PL-HIV reflections and the biography of PL-HIV and publishing of the biographics on the as a hard copy or on the website. Successful marriage, one of the most familial problem among people living with HIV is the successful marriage. Is a marriage and the finding of the appropriate couple is very difficult. So for this reason, individual consultation by the psychologist for successful marriage is very important in positive club, and usually positive clubs do the activity in the club. Other activity regarding empowerment is providing a stationary clothing and shows for children living with HIV, and have a cost, but Positive Club try to tolerate the cost of this activity for children living with HIV, and other activities, the knowledge transferring and exchange. For example, we held some classes regarding the result of the research in the Iranian Research Center for HIV, and transferred the result of our research to the people living with HIV, and for familiarity with the research and results, and doing research by researchers in Iranian Research Center and other researchers. And other activity regarding empowerment, training of talented peers. I think that one of the most important activities in a Positive Club is training of the talented peers and using of peers. Based on the guideline of PC guidelines in Iran, the management of the Positive Clubs are with one manager of the Positive Club is HIV negative or HIV positive, and the other manager by peers, educated peers, can help to the activities and managing the Positive Clubs, and according to group discussions with the people living with HIV, it seems that using peer is very mandatory and is very useful for delivering services in the Positive Clubs. The other activities, advocacy group with PL-HIV is a good idea in some Positive Clubs. Also, people living with HIV involved in policy level with, for example, CCM, country coordinating mechanism, and CCM is governing the Global Fund proposals and supervise the Global Fund proposals and the funding of the Global Fund to the other sections in the country, and supervise the route of delivering services regarding the fund of the Global Funds in Iran. And actually, one or two people living with HIV are members of the CCM in Iran. For example, we know some women and men are members of the CCM in Iran, and it seems that PL-HIVs are involving in the policy level in this country. And for example, other meetings, for instance, MENA-ROSA is the network of women living with HIV in the MENA regions, and women living with HIV are members of this network in the Middle East and North Africa region. Other activity, cultural, social, and economic support, for example, HIV and social protection programs, training of the social protections, birthday, holding birthday gathering, traditional festival, national and religious celebrations, and providing health insurance and insurance costs for people living with HIV, or helping people living with HIV to getting the insurance, and also coverage of some costs like medical laboratory, as I mentioned previously. Other activities, manual works I pointed out, such as wood carving and for solving the wood carving and the tools to the public, and for public visit and soldering them to public. For example, such as creating the booths for education of the general population, and also introducing of the tools and manual works for public visits or other activities in positive clubs. For example, this published by UNH Dr. Pruhi as the Tehran Positive Club celebrating Valentine's Day, published previously, and the Tehran Positive Clubs celebrating the Valentine's Days, and invited the couples in the Positive Club and celebrate the Valentine's Days. Other activities, human rights. Regarding the human rights is active participation of PLHIV families and key population in the management of the pieces. As I mentioned, that the peers can manage the Positive Clubs and cooperate with the main manager of the Positive Club for delivering services to people living with HIV, active participation of trained peers in various television and radio programs, as I mentioned previously, and right of the PLHI for access to public health services. In the Positive Clubs, the new issue is the legal literacy and training of the PLHIV about legal literacy, and the court and increasing the literacy about the stigma, especially about the stigma and discrimination, and the codes, and to receive the public services. It's very important and is relatively new in the Positive Clubs. Regarding the activities, we designed a model for Positive Clubs and publishing in the book, and also prepared a guideline with the support of the welfare organization regarding the empowerment and support of the HIVs, and send the guideline to the Positive Clubs, because it seems that this that the guideline is effective in the for the delivering services in the PCs. In Iran, 3 Positive Clubs have won Red Ribbon Award. Mashhad, Kermanshah, and Tehran won the award, and they are the winners of the Red Ribbon Awards in the world and very competitive. And the last award is related to 2016, related to Tehran Positive Club and received by the representative of the Tehran Positive Clubs. 31 Award 2016 is in the category of gender equality, SDG, Sustainable Development Goals 5 is according to these SDGs, and regarding the leadership, community leadership in the world for Tehran Positive Club. In this stage, also we have a project on the cost effectiveness of the positive clubs in Iran, and this project is an ongoing project, and we are conducting a research so that the positive clubs are effective or not, and also regarding the cost, we are calculating the cost effectiveness of positive clubs in Iran based on the quality of life, based on the adherence to treatment, and the most important item is the QALY items. We are approaching to the QALY indicator, and we are going to find these activities are cost effective or not for Iran country. Thank you for active participation, and wish to have a good time for this day.
Thank you, Dr. Ali Naqi. It was real nice to hear about this disease, about the positive clubs that you mentioned very carefully. And I should say my congratulations for the Red Ribbon Award that you were a team member from Iran in 2016. It is a great honor for us that there are people in Iran who are fighting for this disease and help to increase the awareness regarding this disease. I had a question regarding the VCT centers that you mentioned earlier. What kind of testing is exactly done in these centers? Is it expensive, or all the people can afford to get tested in these centers?
Thank you. In the VCT centers, all the services are free of charge, and testing is free, consultation is free, the treatment is free. Only for some laboratory tests outside HIV, maybe. For example, some laboratories they refer to the other laboratories or services referred to the other sections, maybe not free of charge. But for HIV testing, ART, antiretroviral therapy, consultation, routine laboratory tests, all of them are free of charge.
So everyone can visit these centers and go for a free HIV testing. Is it right?
Yes. In the VCT centers, pre-test and post in the first pre-test and post-test counseling are done, and after that, based on the result of the test, the approach will be variable, but everyone can visit the VCT centers, and often the center of each city have VCT centers, and about 140 VCT centers are located in Iran country.
Thank you again. Giant thanks for these great notes that today we got. I should say my gratitude to the dental school that let us to hold this campaign today. And we had three valuable speakers. The first one, Dr. Durudi, mentioned about the UNAIDS program. And our second honorable speaker, Dr. Tonakaboni, told about the oral manifestations and also the dental considerations. And finally, Dr. Ali Naghi shed a great light on how we can stand for these patients and how we can support these patients, because patients that are diagnosed with HIV and may have difficult times in living, their lifestyle may be affected and their social life needs to be supported, and we need to increase this awareness. And as a part of this campaign, we try to hold a charity based on the art gallery. I should express my gratitude to the Students International Committee of Dental Students, CCODS, and they did a great job. People came in the morning, they bought stuffs, and all of the proceeds and benefits would go to the Positive Club that Dr. Ali Naghi helped us to be in contact with them. And thank you, everyone. Today, the 26th of November of 2023, was a great experience to all of us, especially the Dental School of Tehran University of Medical Sciences. If any comments come up, we can answer. Otherwise, I should say that stay safe, and I hope you the best. Dr. Ali Naghi, again, thank you a lot for your participation in this program.
Thank you, my pleasure, and goodbye.
Bye, everybody. Stay safe. And also, we have a short clip. If you want, you can stay and see and watch this clip. Dr. Ali Naghi helped us with this clip and provided this clip as a part of the Positive Club for the HIV positive patients. It helps to get better about their stuffs and difficulties. Thank you.
کازرانی هستم، متولد 1342. تا اینکه یه خواستگار پیدا شد که من اصلا دوست نداشتم باشه ازدواج کنم، به زور گفتن دیدم که HIV دارم. خیلی برام سخت گذشت. ما رو چپ چپ نگاه میکردن زمان اول. من رفتم در پزشکی، حتی به دکتر توی مطب گفتم من HIV دارم. گفت وایسا بشینی. تا گفت نمیتونم بکشم چون HIV دارم.
Still we are here. If any question or comments appear, and we have thanks comments. Thanks everybody for this meeting. It was really nice to have you today, and I hope you the best. Stay safe.